I, Renata Souza de Miranda, give my consent to Universidade e Universidade de Los Angeles for the treatment of my data, use and reproduction of the video sequence photographs, recording of my voice and the material of pre-record presentation for the online International Congress of Neuroscience, Brain and Behavior in time of COVID-19, valid for up to 6 months to use and reproduction with attendees of the event, without restriction of geographical area to reproduce this material for the exclusive purpose of scientific and academic dissemination, in accordance with provisions of law 58.1 and 2012, and its regulation, and the personal data process of police of the Universidade El Bosque. I have no conflict of interest. Well done. My name is Renata and my study is about frustration and intolerance during COVID-19 in a Brazilian sample. Frustration and intolerance is the refusal to accept the difference between desire and reality. Intolerance of uncertainty refers to negative beliefs about ambiguous situations. COVID-19 pandemic induces uncertainty about disease outcomes and frustration due to necessary measures to prevent its spread. We test correlations between Fi and Iu among their respective components dimensions in a Brazilian sample. Participants were invited through emails to take part in a study about feeling frustrated. Data was collected online via Google Forms during 2 weeks in September 2020. Participants. The sample was most undergraduates, average age was 23 years, and the most were women. Instruments. They respond to frustration discomfort scale that has discomfort intolerance, entitlement, emotional intolerance, and achievement, and the shorter version of the intolerance sorting scale have inhibitory and prospective dimensions. Results about scores. Only 12% of the sample has high IU and FI. Correlations. All correlations was significant and positive, but here today we're gonna focus on two of them. FDS total with IUS total, FDS with emotional intolerance with IU inhibitors. IU may increase frustration when people face ambiguous situations, and a pandemic tends to aggravate this effect. Co-occurrence of FI and IU may reflect the discrimination feedback loop, which provokes stress and anxiety. They may pertain to a transdiagnostic factor, possibly related to the dysfunctional of expectance of cognitive control efficacy. Student limitation was the most of simple undergraduate students, but they are all states and regions of Brazil. Future students may approach different samples, such as clinical groups and health professionals. This is reference of student. This is. Thank you.